Hello guys, this is me Dr. Kashan Qasit. Today here we were discussing the ECG patterns. In previous lecture we have discussed the atrial flutter. Today we are going to discuss another topic, which is ventricular tachycardia. So basically ventricular tachycardia is defined as 3 or more extrasystoles with a sustained ventricular rate greater than 100 beats per minute. So this is the definition. Moving next towards the important point, which is the ECG changes seen in the ventricular tachycardia. So the ECG changes we will notice on the ECG paper are: number 1 here is the QRS complex, which is greater than 0.14 second. We have discussed these seconds in detail in previous lectures. So this is the first change you will notice on the ECG pattern. Then the P wave can be absent. This can be dissociated P wave and it can be seen on a ECG paper as well. The third one here is the rate we have discussed earlier. It is greater than 100 beats per minute, and there is a successive extrasystoles 3 or more also seen on the ECG pattern. So these are the ECG changes seen in the ventricular tachycardia. Moving next towards the causes. The causes of ventricular tachycardia involves acute MI, cardiomyopathy, myocarditis. There can be any drug which is involved like quinidine or digoxin. There can also be other causes like chronic heart disease, mitral valve prolapse, electrolyte imbalance, and post-cardiac surgery. So these are the causes, important causes for ventricular tachycardia. Moving next, there are other types of ventricular tachycardia. So basically ventricular tachycardia can be monomorphic and it can be polymorphic. Monomorphic means the QRS pattern here will be exactly same in the same leads. So in the monomorphic ventricular tachycardia, QRS complex will be same. The configuration of QRS complex will be same. But in the polymorphic, the QRS will be different in the lead and the rate will be irregular in this case. So these are the two types of ventricular tachycardia. There are other types, subtypes of ventricular tachycardia like sustained ventricular tachycardia and non-sustained ventricular tachycardia. Sustained ventricular tachycardia means the ventricular rate is greater than 100 beats per minute and it is lasting greater than 30 seconds, and this needs further immediate treatment for that. While non-sustained ventricular tachycardia involves the ventricular rate again the same and it usually lasts less than 30 seconds, and there are 3 QRS complexes seen within this time period and it usually resolves spontaneously and does not need any treatment. So these are the types of ventricular tachycardia. You should remember the differences between these types. So finally, before going to end our lecture, we will discuss here the treatment plan for the ventricular tachycardia. If the ventricular tachycardia is happening and the patient is hemodynamically unstable, you will go for cardioversion. And if the patient is hemodynamically stable, you will definitely go for the IV treatment like amiodarone. So this was all about the ventricular tachycardia. In the next video, we will be discussing some other topic with another ECG pattern. Hope you like my video. Thank you very much for watching. I'll see you in my next video.